Hello, this is Joseph with Next Gen Manual Therapeutics. And today I'd like to talk a little bit about just the field of hands on therapeutics and the history and where we can go from here potentially. Osteopathy clearly led the field for the last 100 years, starting at around 1900, maybe a little bit before, up until the 1980s. The osteopaths generated cranial therapy, muscle energy technique, strain counter strain, functional technique. They tracked what they were doing and they worked with one another to better themselves and better the techniques they were offering to their patients, to their clients. It was very, conscientious. It was wealth. It was an applied thought. It wasn't an accident. Uh, they got together in groups and tested each other's skills and talked about what they were doing and really developed skills and concepts. Uh, one meeting that affected me and many others was the meeting of Barral and Upledger, which I believe was around in the 1980s. Barral, Jean-Pierre Barral, the originator of visceral manipulation, started writing books in the 80s about visceral manipulation. He had had a client who, I don't know, whatever, I forgot what kind of pain she had. I don't know that she was necessarily resistant to the treatment he was providing, but when he asked how she was doing, she said that she was doing much better. He asked what was different. Well, she had gone to see this healer or something in a nearby town. Well, he was curious and he went and looked, and what he saw was that she was providing some kind of massage-like techniques to the abdomen, to the organs, right? But he saw the value. He saw that the person was better, and so he started developing a model around that. So that's very, to me, that's fascinating, right? He was open-minded. He didn't think he knew it all. He went to see himself for himself, and he didn't stop there. He continued to develop the model, and in fact, he's still writing books. He's probably one of the most, if not the most, prolific writer in osteopathy to date. I mean, I don't know how many books he has at this point, but I know he's recently put out even a few more, and that's since the 80s. There's a lot of development over uh, 40 plus years. But he got together with John Upledger, and they started teaching to not only together but kind of concerted effort to bring these skills that they were doing, cranial therapy and visceral manipulation, to interested practitioners. And Upledger still exists today. Upledger's been gone for a long time, and so the folks that have followed him are still running that organization. And Baral is still involved, through that organization. Will come and teach in the United States, and of course teaches in France and teaches in various osteopathic schools. Uh, but the big gift of that is that there are many other practitioners now that have accessed that information, developed that information themselves, and are offering it to clients. And anyone in this field really knows the need, whether that's a post-surgical need, whether it's from hip or some kind of joint replacement or auto accidents, scar tissue from surgery, scar tissue from some other incident, an accident or some other kind of trauma. The effects of, say, some kind of blunt force trauma on the cavity pressures, concussions, whiplash. I mean, it's really vast. And the things that good therapists are able to work with and ameliorate, help people move beyond, it's really should not be ignored. and yet they're not really well known even now to many doctors, to many, and it gets very territorial, right? So you have somebody that just sees the spine. They've relegated, massage therapy to, just doing the muscle. They've been very successful at that. I know the massage therapists I can remember. I don't know when that was. Maybe back in the 90s, people were really excited that they showed, a massage therapist doing massage on Seinfeld. It's really coming out now. It's going to be accepted. And, it was harbinger of, it's true, right? It ended up being much more accepted. It's much more prevalent. And I think that often is the limit of what the public perceives as the usefulness of touch therapy. That's rather unfortunate, because that's really more of a personal service, and that's great, and rather than a health service. And that doesn't mean that there isn't health benefits to be had from something like massage therapy and just touch. We know from the work of like Tiffany Fields, who did all the work with infants and touch. And there was work on failure to thrive before her, but she really developed that work. Has written at least a book or two on the benefits of touch in infants and how that affects growth and brain development, neurodevelopment, all this types of stuff. So, social development. But really, there's other like mechanical and tactile, palpatory skills that can really be used to really broaden and deepen the effects that you're able to the effects that you're able to have with a client. For example, again, say massaging a scar is one thing. Doing, let's call it myofascial release on a scar, is something very different. To work on the circulation, to move fluid by, say, rubbing, or what in massage they might call effleurage, that's great, but that's very different than releasing a tension around the neurovascular bundle and amplifying blood flow, blood drainage, lymph drainage, due to an impingement at a critical area in the body, say the thoracic outlet. So this is just to kind of make some differentiations. One little other point that I'll put in this particular video, if you stayed this far, another thing that happens with kind of basic training is someone's around a therapist that maybe has developed some skills, some palpation skills, some perceptual skills, and of course they want that, and that's great, right? To be motivated to develop their skill set. What often happens is that a person will jump to the idea of developing their intuition. Now, intuition's great. I'm not saying that we shouldn't use our intuition. I'm saying that there's a whole body of skills, tactile skills, palpatory skills, hand skills, that are, they're much more kinesthetic in nature than just imaging in one's own reflective mind what's going on with a person. It doesn't mean that the information that one receives is inaccurate necessarily. Think Carolyn Mace and all the medical intuitive stuff, for example. But I'm just making the point that you're getting the information via a different pathway. And if you rely on that as a hands-on therapist, then you just won't, if you rely on, let's call it medical intuition to be generous, then you're not really developing your hands-on skills, right? So you want to, as a hands-on therapist, to me, you want to develop your hands-on skills so you're able to perceive with your hands, with the person in front of you, the various things. Developing one's intuition comes along for the ride, and my general take on that, I think that there are different tendencies within the person, like just any of us, like a kinesthetic tendency or a visual tendency or an auditory. This kind of certain capacities come easier for some of us. But you can certainly develop any one of those in a conscientious way. And the tactile thing really has so much to offer if one's a hands-on therapist. So really kind of a, just it's kind of an aside, and yet it's kind of a big aside if someone really wants to develop their skill set. Jumping over that bridge will not deliver. You may develop your intuition, wonderful, but that will not necessarily have given you the hands-on skills that would have otherwise been developed if you took your time to feel your way through and develop those piece by piece. Thanks for listening. And again, this is Joseph Schindel, Next Gen Manual Therapeutics. I'll bring some more information to you later. Bye.